Hello, welcome to the presentation, Lifting Up the Family Voice in Early Intervention Pre-Service Training, the Early Spots program. Thank you for joining our presentation. We hope that over the course of the next few minutes, we will describe how to incorporate families into early intervention, interdisciplinary personnel preparation programs that include the disciplines of occupational therapy, physical therapy, and communication sciences and disorders students. So just a little bit of background. Across Georgia, there's a serious shortage of related service providers. And that certainly adds to an issue in terms of providing appropriate services for infants and young children with disabilities and their families through the early intervention program. In 2020, there were 261 speech language pathologists, 153 occupational therapists, and 138 physical therapists working in the Part C early intervention system. Nationally, children are served under Part C has increased by almost 3%. So it's important that pre-service education provides opportunities for students to learn about supporting infants and young children with disabilities and their families. And we identified that there is a gap in terms of the preparation that is included across these three disciplines in the training programs. So we would like to introduce to you the faculty of the Early Spots program, and that is the interdisciplinary personnel preparation for early speech, physical, and occupational therapy services. We have Dr. Emily Graybill, who is an associate professor in the School of Public Health and also the director of the Center for Leadership in Disability. We have myself, Dr. Akilah Heggs, an assistant clinical professor in the Department of Communication Sciences and Disorders, Dr. Yuping Chen, an associate professor in the Department of Physical Therapy, and Dr. Sutanuka Bhattacharjya, an assistant professor in the Department of Occupational Therapy. We would also like to mention Ms. Angela Miles, Dr. Laura Wood, and Dr. Lindy Parker for their contributions in the program as well. So we've designed our program to include these three disciplines with 4 students, or what we call scholars, from each discipline. So we have third-year students from the Doctor of Physical Therapy program. We have 4 students who are second year in the Occupational Therapy Doctorate program, and first-year students from the Communication Sciences and Disorders or Speech Language Pathology graduate program. We solicit these students to apply for consideration for the program. We interview them and we select the top 4 scholars from each discipline. The program is 1 academic year. It begins with a summer intensive orientation at the beginning of fall semester, where students and faculty come together for a 3-day orientation to really introduce them to early intervention and the Part C system in Georgia. It also is intended to allow for cohort bonding and building opportunities amongst the three disciplines, the students from the 3 disciplines, so that they have an opportunity to start to learn about each other individually and their specific disciplines, as we hope to create opportunities for them throughout the course of a year-long program to work in interdisciplinary groups.
Now, throughout the presentation, what we are going to also demonstrate are some examples of how family voices were highlighted throughout the program through various different courses or panel discussions and orientation program. So in the next slide, you are going to hear and see a description of how family voices were introduced during the summer orientation. Parent leaders were interviewed, and this is a section of the orientation program.
What would you like to share with a provider who is just beginning a career in early intervention?
I would say, it's just really important to connect with the parents. And, they want to, a mom wants to see them interact with the child and be engaged. But as soon as, a few minutes go by and you kind of establish that rapport with the child, and the mom can see like, okay, they're playful, they're going to connect. To turn, make eye contact with the parent and really listen to what the concerns are, and listen, to their questions, and share as much information and resources as you can, and be encouraging of like, this is where we are. It's yes, he or she is behind, but these are some tactics that we can do. Here's something that you can read. Here's a website to check out, and we're going to set some goals, and we're going to get on this, mom, and, we can do this.
Again, it's all about recognizing that it is a team effort. Be as honest as you can, but be as kind as possible, because as parents, you sit through so many meetings that tell you what's wrong with your kid. But, and we need to hear that. We obviously desperately need to hear the reality and the truth. But I would say figure out ways to communicate kindly and respectfully, and understanding that the parent is going through all kinds of different things at the same time, and the family dynamics of what that looks like. And as you start your journey, I think just be open to learning from your peers. There's constantly an overlap between what you all do for these children. And so don't be afraid to ask questions of each other. Be respectful of each other and what they bring to the table, and very much understand that the impact that you're having on these families and these kids.
I would say first of all, always remember why you got into your field, because you guys are our heroes. I always, whenever I hear somebody's going into speech or therapy or PT, I'm like, oh, pediatrics, you're gonna love it. It's cute. But remember why you got in there. And, I would say just entering into it, stay true to your heart, stay true to your passion. When it gets tough, then remember why you got into it. And also when you're talking to parents or families, just remember that, have that empathy of where they came from, and partner with them. That relationship is going to get you so much further. And that is what I would probably tell you, just getting into it. Stay true to yourself, remember why you got in there, partner with the parents, make it a team, come in as a team. And that would probably take you a long way in your career.
Okay, so as Dr. Heggs mentioned, there are 3 courses within this program. One of them is about evidence-based practice and research skills, and the other 2 courses primarily talked about family voices and how to develop skills for these interdisciplinary scholars to interact with families. One of the course was the family-centered care. The purpose of this course was to illustrate how the family is the central aspect of an infant or a young child and with disability, and how the scholars can then interact and communicate with families effectively during this process. They also learned developed discussions on how to facilitate interdisciplinary collaborations while understanding and respecting roles and responsibilities of each member of the team. The other course is the teaming and collaboration, and this course was designed to help students apply model skills and processes to collaborate and communicate with families. It continued on from the family-centered care and took it to another level of the interaction with the families and understanding how to respond to and how to collaboratively work with culturally and linguistically responsive services, how to provide these services, how to work with various providers. Next slide. In the family-centered care course, the scholars learned about roles and responsibilities of each member, each team member. So they learned about their colleagues in the other departments. They also learned about roles and responsibilities of other team members other than OTPT and speech language pathology who might be there as a part of the program, and also roles and responsibilities of the families and the child. So they learned about how to conduct effective communication with each of these members, and then learned about communication strategies for coaching family members within this program. Some of the competencies within this course included interviewing parent leaders on multiple aspects. One of the competencies, for example, was directed towards gaining a better understanding of the family itself through interviewing the family leader to understand the various components of the family systems theory, to understand what are the factors that are essential in the child's developmental process, in the child's life, in their day-to-day routine, that influences their development in the various aspects of physical, motor, socio-emotional aspects, communication skills, and so on. The second competency, for example, looked at family assessment. So here the scholars, always working in interdisciplinary teams, interviewed the parent leader to understand more about their family, understand about their child, what do their daily routine look like, what are the routine-based activities, what are the interests of the child, and how does the caregiver respond to it, what are typical strategies that they use. These competencies were aimed towards helping the scholars develop skills that would eventually help them to develop IFSPs in later stages. So that was part of the family-centered care. Next slide.
And then in the teaming and collaboration course, the scholars continued to work in interdisciplinary groups. So there was one student from each of the disciplines grouped together where they learned about the different aspects of the early intervention system, and particularly how that applied to teaming, certainly centering the family, as well as collaborating with other disciplines and community supports. So one of the assignments for the course was to respond in interdisciplinary groups to discussion posts and prompts. And there were several targeted prompts around centering families as part of the team. And so there were case studies and vignettes that were presented for the interdisciplinary groups to respond to, in terms of how that case study or scenario may have properly included the family as a part of the team or not, or opportunities to improve those interactions. We used resources from the Early Childhood Technical Assistance Center, or ECTA, such as the Families as Full Members checklist as a guide for students to use as they were reviewing the vignettes and case studies. And that particular checklist includes steps and actions that teams can take to ensure that families are included as full team members and are valued as experts who are considered vital to effective team functioning. So as they reviewed the case studies and vignettes, they particularly highlighted ways in which the team members or the discipline-specific team members could have been more supportive of the mother or the family member in the vignette as a member of the team. Some of the things that were highlighted in terms of areas of improvement were consideration of the family's availability for meeting with the rest of the team, reducing the use of jargon during team meetings, and learning about parents' preferences, particularly as it relates to their identity and their cultural and linguistic preferences as well. Next slide. And then the third component of our program is where we have monthly early intervention learning communities. And so this is an opportunity outside of the classroom courses for scholars to interact with professionals within the early intervention community. And so we ended with an early intervention learning community focused on culturally responsive care. And we had a panel that included 2 clinicians and 1 family member. So we facilitated a discussion where scholars were able to ask and learn from the panelists about ways in which professionals can be more culturally responsive to the children and families that they serve. Part of the discussion included thinking about the disparities in care for children and families from culturally and linguistically diverse backgrounds, and how to, again, really center family preferences, their cultural norms in terms of disability and in terms of interacting with those inside of their home and from those who may speak languages other than English. We also talked about ways in which students can really be intentional about ensuring culturally responsive practices to support children and families. And so it was an exciting conversation where students were able to, by now at the end of the program, really incorporate and apply many of the principles that they learned through their coursework and their clinical training, respectively, in their discipline programs, to really think about how to be culturally responsive in the early intervention setting. Next slide.
So we assessed the scholars' self-rating of their skills in the area of family-centered care. And we did this through a post-retrospective or retrospective pretest that was administered to scholars at the end of the program, and also through a solicitation of quotes and feedback from scholars. And so now we'll show you some of the data that we collected from both the retrospective pretest and the scholars' own voices on this topic of family-centered care. So we have 6 or 7 questions that we asked the scholars. We asked them to rate their perception of their skill and competency on different aspects of family-centered care before participation in the Early Spots program and after participation in the Early Spots program. So on these next several slides, the figures that you'll see on the left show the Early Spots scholars' rating of their skill prior to participating in the Early Spots program, and on the right, you will see the data on the scholars' self-reported assessment of their skills after participating in the Early Spots program. So with this particular item, we asked the scholars to rate their skill level related to building a relationship and a partnership with each child's caregiving family to support their participation in their child's intervention and learning. And you can see that prior to participating in the Early Spots program, the scholars reported, over 50% of the scholars reported just some skill. At the end of the program, over 50% of the scholars reported fully skilled. This next item, we asked the scholars to rate their use of effective communication skills with families across all cultural, linguistic, and socioeconomic backgrounds. You can see it before the program, more than 50% of scholars reported some skill, and after the program, nearly 50% of the scholars reported being fully skilled, feeling fully skilled on this particular competency. And then with this next item, which is include the family in all components of early intervention services and early intervention service delivery process. And you can see that we had 30% of the scholars who reported that they had no skill in this particular area, and no scholar reported that they were fully skilled on this particular competency prior to the program. And after participation in the program, no scholar reported that they had no skills, and most of the scholars reported that they had a high level of skills or that they were fully skilled. So this next item, we asked the scholars to rate their skill level on providing information, guidance, and education to families about child development and their child's health and safety needs. And again, you can see none reported feeling fully skilled before the program, and half, more than half reported some skill or less. After the program, the scholars, most of the scholars reported either a high level of skill or feeling fully skilled. On this next item, we asked the scholars to rate their self-assess their ability to provide information, guidance, and education to families about early intervention and inclusive service delivery models. All scholars reported either some skill or less, with nearly half reporting no skill, and we had almost a flip of those data at the end of the program, with nearly half of the scholars reporting fully skilled and almost 40% of the scholars reporting high skill in this particular area. The next item was prepare the family to participate and contribute to the development, implementation, and evaluation of their child's IFSP or IEP, including transition options. You can see that 3/4 of scholars reported no skill prior to the program, and nearly that, or more than 3/4 reported either feeling fully skilled or having a high level of skill after the program. So we're seeing great gains in the scholar self-reported gains. The next item was to refer families to resources and services to help them meet the needs of their child, their family, and themselves. Again, nearly 70% reported no skill in this particular area prior to the Early Spots program, and over 70% reported either having high skill or being fully skilled after the Early Spots program. And then finally, provide information to the family about parental rights and safeguards and how to advocate for themselves, their family, and their child. Again, nearly 70% reported feeling like they had no skill when they entered the program, and that those data flipping with nearly 70% reporting either high level of skill or feeling fully skilled. So with the different ways that the family voice was incorporated into the Early Spots program, our scholars reported real gains in their self-assessment of being able to implement a family-centered care. So then we asked the scholars to reflect on what they gained in the area of family-centered care from participating in the program, and we'll share their voices with you now.
I think the most valuable thing I've learned so far, it's been in our family-centered practice class. That class was really neat for a number of reasons. One being it overlapped with a lot of stuff that I was learning in the speech program. But the opportunity to think about families and the family systems and then interview families was a really neat experience that I was able to kind of like merge what I was learning in that class with actually a clinical situation in the fall. And also family center practice was a buzzword in another class that wasn't even related to intervention. So it was just really neat to see that and have those opportunities.
I think the most important thing I've learned in the Early Spots program has been about family-centered care and the role of the therapists with the families. We've talked a lot about getting to know the parents, getting to know the families and what they need, and how the parents are really the experts on their kids. And I think that's a really important lesson that I'm definitely gonna use in my practice, I hope.
I think I've learned that it's funny because obviously all families are unique and all circumstances are unique, but I think I've learned that there are also common threads and common things that we need to make sure that we're doing to be positive and be helpful towards all families. We had the opportunity to interview a few parents of children in early intervention last semester, and I think that was very eye-opening of just certain things that work and certain things that don't work. And like I said, even though all families are unique, there seems to be common threads within those conversations. And I think big ones are just open communication, putting your ego as the therapist and healthcare provider to the side and making sure that the family truly is the center of your care. They're the expert on their child. I think that's something we always talk about, and that's so important that they know their child more than anyone else, and so they should be the ones who we're listening to. And then I think just what I was saying about sort of stepping aside, putting your ego aside, and making sure that you're the best provider for that family. You're the best provider to take the lead for that family. And if not, then asking for help and asking for advice from other disciplines, and asking for strategies from those families. And so I guess the big thing just being open communication, putting the families first, and sort of finding out what they want out of therapy, not what you want out of therapy as the healthcare provider.
So I think one of the most essential things about working with families is learning that they are essential members of the team and that you are partners with them. They are equals. They know their child best, and we should respect parents' opinions and honor their priorities.
Well, I've definitely learned to get to know them. It's possible to give the best care if you don't know clients, but also their families, since we're working with such young children. So just asking a lot of questions and always be noticing and observing what you see and what you hear. And everyone has different communication styles. So just really being able to communicate with the families that we're working with in whatever way works best for them.
Well, thank you. And we would be happy to speak with anybody who might have questions about how we incorporated family voice from the orientation into the courses in our professional learning community and on our advisory council. So we appreciate your time today.